Hello, and thank you for joining today's webinar. Please share where you're joining us from today in the chat.
Oh, Massachusetts. I bet it's called there. Connecticut. Same for you. New York and Charleston. Fabulous. Oh, you guys are getting quicker than I can read them. Dallas. We're not far away. Austin. I'm here in Oklahoma, California. Texas. You guys might end up in the playoffs. Spartanburg, South Carolina. Edmonton. Ooh, hi. Welcome. Washington, Georgia, Miami. Oh, you're definitely warmer than we are. Another Austin. Couple of Richmonds. Nova Scotia. Fantastic. Man, it's gorgeous up there. I haven't been there in a while, but I'd love to go back. Savannah, another pretty town. More Fort Worth. Pennsylvania, you have like the longest state name. Grand Rapids, Michigan. We were just talking about Michigan before you came on. Like everyone who's really from Michigan always points out where they're from on the mitten, on the hand. Nashville. Wow, you guys had a big election the other day. Arizona, Jacksonville, Rhode Island, California. Okay, more California. Well, welcome, especially all you guys are in different time zones. So we appreciate you coming at no matter what time zone you're in. Now, I think we have two other people on the call with us, and I think Monica, it represents Sigma. And we also have Margot, who is one of my colleagues at Lecturio. So I'm just going to check in with Monica and see if there's anything else, announcements she wanted to make before we get started with the content. Monica, is there anything else you wanted to say?
Yeah, just have a couple things to say about how to do some things with our webinar. Um, do you want me to do your bio, or we just want to skip that today?
You know what? I'll let them know. You can go ahead and do the bio. I think that Sigma would prefer that we do. So why don't we do that?
Okay, all right. So, hello, and thank you for joining today's webinar. We're ready to begin. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we will have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so that the message makes it to us. And please use the Q&A for questions and the chat feature to interact with other participants. We would like to thank our speaker for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect that of Sigma. Our speaker today is Dr. Rhonda Laws. Dr. Laws is a highly respected nurse educator, clinician, and leader with more than 30 years of experience in nursing and over 2 decades in higher education. She currently serves as an active faculty member in a Bachelor of Science in Nursing program and as the Chief Nursing Officer at Lecturio Nursing. Dr. Laws holds a PhD in educational psychology with a research focus on academic resilience, self-efficacy, mindset, and evidence-based strategies for teaching and learning. Her expertise in these areas has informed her dynamic and student-centered approach to nursing education. In addition to her academic and clinical roles, Dr. Laws is nationally recognized for her extensive experience in NCLEX preparation. She spent years equipping aspiring nurses with the knowledge, skills, and confidence needed to pass the NCLEX RN exam. Through engaging lectures, innovative teaching methods, and a deep understanding of test-taking strategies, Dr. Laws has helped thousands of students navigate one of the most challenging milestones in their nursing careers. Her dedication to student success and passion for nursing education continue to shape the next generation of compassionate, competent nurses. And now it is your turn.
Thank you, Monica. Well, guys, welcome. I am so excited to be here, and I genuinely mean that. I wish I could send a hug to each of you because I know this is the point of the semester that's really, really difficult. Like she said, I am teaching in a pathophysiology course in a nursing class right now. So I know those guys are so tired. They're great. I love being with them, but I know this is a really rough point in the semester. So what I'm going to give you today are test taking strategies that'll work both for the NCLEX. And remember, we have a complete NCLEX review for you. And I'm going to also give you tips and strategies that you can use on any exam. Because even if you are going to take the NCLEX in December, you need this information to get through those finals and get ready for that. So if you wouldn't mind, in the chat, would you tell us when are you planning on taking the NCLEX? Doesn't matter if it's 3 years, 2 years, 1 month, in May, but let us know the year and the month that you plan on taking the NCLEX. January 2026. Oh, I'm so excited for you. Okay, fabulous. That would make sense why you guys are here in December. That's great. Now, what I want you to do, if you look on your screens, you'll see that we have the app. I would love for you to take a second right now and download the app. Use whether you have Apple or Android, hit that QR code. Please make sure that you download the app because we're trying to gauge if this is really helping students. So we know if we can see a number of people that sign up today, it's completely free. You don't have to put a credit card down and you get access to these super cool cheat sheets. See those over there? Yeah, so keep an eye on those. You'll get them. It'll help you with your studying for your finals and it's absolutely free. Now there is a paid subscription to it. We'd love for you to obviously to join us on that, but I promise you that this today doesn't take any extra money and it's going to help you get ready. Okay. Now we have another QR code and we'll show these to you again. If you want to, you can also set up your account on this and it gives you 40% off. So you can also set up the account with this QR code. And I'm going to ask that Monica and Margot make sure that we have the URLs also posted in the chat from these so that you guys, if you want to do it that way, you can get to it. So let's get to the heart of what we're talking about. Now, I really have worked with a lot of NCLEX students. In fact, I tutor in my community anyone who has not been successful because I cannot imagine what that would feel like. So I want you to know that anybody really can do this. Once you graduate from nursing school, you have the knowledge that you need. I'm going to show you how to take the knowledge that you have and tweak it and build on it and use that as a foundation and show you how to be successful on the NCLEX. So no matter how you're feeling today, which oftentimes in nursing school, it makes you feel like the slow kid or the one who doesn't get it, or this is humanly impossible. Anyone feel that way? Tell me in the chat how if you picked one word about how you're feeling today, what would you, I'm going to put the 40% discount up for you again. I see that there. But if you had to pick a word, if I'm going to ask Monica and Margot, if you guys can post the 40% off, overwhelmed, stressed, anxious. Absolutely. Those are all really normal. Yeah. Wow. Seeing it frustrated, determined. Wow. You are awesome. That's great. Fatigued. Yes, I take community health next semester and scared. Okay. Wow. You don't often hear that. Sluggish. I get it. I get it. Okay. Well, these are the kind of things that I work through when in my own life, because we all struggle with these things, particularly with academics. So what I want to tell you is, first of all, feelings are not facts. It's okay that you feel those things, but I promise you that you absolutely can do this. And I'm going to give you practical steps on how to do that. Now, you don't have time for people giving you all this kind of theories or inspiring things about climbing every mountain. You want to make sure that you have some really practical steps. So I want you to figure out how we can pick the most correct. I know that's annoying. How to dissect a question and how you can figure out this one sentence that changes everything. I had a student text me last night about number 3 that you're seeing on the screen. She couldn't figure out why this question, she got it wrong on a practice test. And it all came down to that last sentence. She missed it. So common problem. And the good news is it's an easy one to fix because nursing school, I always include this meme. This is what it feels like, right? Now, how did you feel with the first nursing school exam you took? Can you give me one word in the chat? What was a word that will describe how you felt the first nursing school exam? Because they feel impossible. Oh, proud. Fabulous. Fabulous. All right. Excellent. Scared, indifferent. Wow. I was not that calm. Yeah, I felt lost. I'm with the L people because this is what it feels like. Like, oh my gosh, which one is the orangest? Well, that's how the questions are going to come in. Now, as you first start nursing school, it's kind of something you have to work through, isn't it? You have to know that sometimes there's going to be four correct answers. Those are priority questions, and they're asking you to pick the one that's most correct. Now, I'm going to give you some strategies that'll show you how to pick the one that's most correct. Now, you can have questions that look like this. They might look like four option multiple choice. Let's not go down that bunny trail. But if you want to know more about the types of questions that are on the NCLEX, I have special videos that go over each different type and special tips for that on how you can do it. So we've got lots of hours. You'll see that this is the NCLEX RN review course. This is what it looks like. And it means that in this course, you and I will go through questions in every one of the on the categories on the NCLEX, and I'll walk you through specific strategies for each category. These are things that I've learned over 20 years of teaching NCLEX reviews, and I promise you they are based in what we know from the National Council State Board of Nursing, the people who write the exam. Sometimes nursing faculty can kind of fudge a little bit on what they tell you about the NCLEX, but I promise you everything here has been fact checked with the NCSBN. And if you ever have a question about the NCLEX, you're welcome to contact us. Also, know that NCSBN is the ultimate authority, and they're always available to you to contact. So this is just a little bit about what our NCLEX review course is, and it is all included in that monthly subscription. So if you do a monthly subscription, you get the full NCLEX review course. You don't have to pay another $400 or $300 or whatever. It's right in that small monthly price. So those of you taking it in January, you've got a great opportunity to get that in. So you already know I'm going to click through this one. Sorry, this got stuck. What I want to talk to you about are these little guys, right? Ants. Those are automatic negative thoughts. Now, we're not having apparently my is having some problems here, but we can work with it. Let me talk to you about automatic negative thoughts and try not to look at that question because you're going to get wrapped up in reading that and it's not going to be what you need. Automatic negative thoughts are things that pop into your head when you're on a test and you're stressed. Have you ever had the experience where you answered a question and then you go through and you want to talk to your faculty about it or somebody who knows how to answer those questions, and you ask them, like the student just did with me, why is this one the right answer? I've gone back with students and I've talked to them and said, do you know why you picked this one? Can you help me understand? And sometimes a student will say, ugh, I have no idea why I picked that one. The difference is in a calm brain that's not taking a test, you can think more clearly. So see, that's part of the challenge. When you're in a testing situation, whether it's a school test or an NCLEX test, your brain is in stress mode, right? You're in that sympathetic mode. Now, as a side note, I always tell students, if you have genuine test anxiety, like the kind where your heart races and you go into that extreme stress mode, you can try a little beta blocker, right? And that has worked beautifully for patients. Anyone will prescribe that for you. There's no street value to it. You can just take it on testing days, and that will help you stay calm. That will stop your heart from racing and feeling like you're going to die, and you can think through. But all of us struggle with those negative thoughts. It's a big thing. You tell yourself things like, I can always get it down to the last two, and I always pick the wrong one. Well, that's a pretty emotional statement. Remember, that's a feeling, and feelings are not facts. And if you don't know, like even as an adult, I have to tell myself, who should be a grown-up adult, feelings are not facts. How you're feeling about this situation isn't always accurate. So think about when you're on a test, the most important thing is if you can control your automatic negative thoughts, those squirrely little ants that pop up in your brain. Nothing in that thought process will help you. I told you I've worked with, I think we're at over 7,000 students now, helping them get ready for the NCLEX. That just me personally has been with them. And The number one reason when I tutor those students who have failed the NCLEX is not a content issue. It's always a controlling your mind and not letting those automatic negative thoughts. You know, the kind when you start the test, you think like, that's it. I'm never going to pass this test. I'm never going to make it. I'm doomed. You know, you start that negative thinking. If you can get you to control that and say, that is not helpful right now, that's just a feeling. I'm going to focus on this question and use the tools that I know how to use. Now, I'm going to give you 90 seconds here, and I want you to use your typical test taking strategies. Like if you're taking this question, you would just go ahead and do this in your regular format, and I want you to pick an answer choice. So I'm going to go off screen for 90 seconds, and you do your typical test taking stuff, and then we'll come back and talk about it. Okay, one more thing I'm going to ask you to do. If you could put your number that you picked, right? So if you can put your number that you picked in this as the correct answer. Okay, yep. And don't pay attention to anyone else's answer, right? This is just for you to say, like, you got to pick something. Okay, yep. Don't look at any other answer. Just put yours in and we'll be ready to go. Okay, hold that thought. And I love it. Those of you that are taking advantage of this, good deal. Remember, this is a completely judgment-free zone. So don't worry about it. We're never going to look back at those, but it's really important that you own the answer that you picked and think about how you got there. I'm going to help you with some better strategies. All right, so we know another ant is definitely, I can always get it down to two answers and I always pick the wrong one. That never helps you. And I can tell you as a researcher, we've actually watched students do this, and it isn't always they get it down to the two most correct answers in actual practice. It's what it feels like to them. That's not really true. Sometimes and oftentimes, you are choosing between two wrong answers, a wrong one and a wronger one, but your mind will remember it that you were going to pick that right one. So keep that in mind. Sometimes that does happen, but it's not always. So when you feel yourself telling yourself, I always, and I do that, don't stop that right away. You want to know that you can pick the correct answer and you're going to work through the ways to do it. The number one rule, the number one goal is safety. So in any exam, what they're looking for is, are you a safe nurse in this made-up scenario? So safety first is the most important thing for NCLEX. I'm going to help you explain what that means and how to apply it. So safety, it is all about patient safety. And it's for this particular patient in this particular setting, what keeps them the safest. So when you're taking any test, keep that in mind, and particularly the NCLEX is all about, are you safe? Because a minimum passing score means, yes, absolutely, you're safe. So you see that up on the screen again? That's orange. If you're taking notes, this would be a great thing to write down. For this particular patient, particular setting, what keeps them the safest? If you just started doing that, thinking that through as you're eliminating answers, I promise you, your answers will change and your scores will go up. Particular setting, particular patient, what keeps them the safest? And let's look at how you do that. We're always focusing on the safety. So you're thinking about particulars about the patient can be any one of these variables, right? Age. They can be a pediatric patient. They can be a geriatric patient. Age can impact because the stem of the question, the words that are in the question, that's the context of the question. Students always or often ask me, hey, on this question, which one would you have picked as the correct answer? You can't ever tell what was the correct answer unless you have the whole stem of the question, the words before the answers, and the answer choices, because it's all relative. Context makes the difference. These particulars are what help shape the context. So a patient's age, sometimes their gender, what they're complaining of. I can tell you if you ever have a question and it says, the patient states, the patient says, ding, 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 you've won the lottery, because that's going to be super important. Whatever the patient communicates to us, if it's directly in words, absolutely. Or if the patient communicates to us through their symptoms or their facial expressions, don't overlook that. That's always important. Medications can throw anything off. Now, some people feel like they'll come after their NCLEX and they'll say, my whole test was meds. It might have felt that way, but everyone has the exact same percentage range of what percentage of the NCLEX exam is going to be the pharmacological therapy section, right? That there's only everyone will have the same amounts. You roughly around 18% of your exam. However, couple things. Some people are really afraid of farm, and so they panic and think, oh my gosh, that is so scary. And you can check out, we have a couple of farm reviews. If those of you getting ready to take the NCLEX, we have some shortened versions that are available on the Sigma website. We are so excited to be partners with Sigma. They chose us as their exclusive NCLEX review partner. So that was a huge deal to us. And so we do these webinars together as partners, and we also have those on file. They're in the repository, and you'll get something about that following up with this system, with this setting. So I want you to keep in mind, you've got these particular patient variables, and any one of these can change things. We were just talking about medications, which has an emotional ring because everyone has the same amount, but medication names can show up in multiple categories. So you may see a lot of drug names. You might even see a drug name you've never heard of before, and that's okay. We're going to give you strategies on how to work through that. That doesn't mean nursing school failed you. That doesn't mean you failed your nursing school. That means there are so many medications that there is a chance that you see one that you don't know what it is, but we'll give you some strategies. So keeping these things in mind, knowing that these are things that can change the context of the question means they can change the correct answer or which one keeps the patient the safest. Now, diagnosis and procedures, I can teach you how to take notes in a way as you're preparing for the NCLEX that will help you be ready. But a key there is you have to know what the risks are, what the worst case scenario for anyone is that's undergoing a diagnosis or a procedure. Okay, so pause for just a minute. And I want you to give me a couple words in the chat. What is something that is new for you? Or what is something that you're going to be thinking about that we've talked about that will apply to you and how you take tests? Can you formulate that? Can you give me a couple words in the chat? Safety first. Excellent. Safety first, always. Yes. Patient say, okay, there you go. Using what keeps the patient safest. Okay, you guys are already sharp. You're going to do just fine. Ooh, and not to rush through. We always want to do that. I'm going to rush through the questions myself because I want it to be over. Positive thinking, very cool. I'm a worrier, so none of you can out worry me. I guarantee it. I always struggle with that. So we got it. Particular patient variables. Here's particular setting variables. Why this matters. If the question is, let's say you're at a park, you're a school nurse and you're on a field trip and a kid gets stung by a bee. Well, if you just automatically slam, that kid with an EpiPen, that might not be your first objective, right? That might be the best one. But in an ER, absolutely. They're coming to the ER, they're having trouble breathing, there's other things that need to be there. So you're going to treat the most important thing to do in a setting like the ER versus an elementary school field trip a little differently. So keep that in mind. These are just some examples of the settings that you can see, but there's lots of them. So you want to be thinking about, here's another one for you NCLEX test takers. Because those of you that are taking tests in your school programs, those questions have not gone under as much scrutiny as an NCLEX question. NCLEX questions go through all kinds of special data and statistics and multiple edits, multiple edits, multiple edits, right? And when you take your NCLEX exam, 15 of those questions won't count. You won't know which those 15 are, so you just treat everyone like it's the most important, but 15 of them don't count because they're collecting a lot of information about, oh, that distractor is not strong enough, or this was confusing, or students didn't pick this. So know that there's a different set of criteria for NCLEX questions because they have the opportunity to go through so much testing. That's not possible in a nursing program, but I want you to know on the NCLEX, you have to think about what do they need right now to be safe? What's imminent danger? You do want to think about airway, breathing, and circulation, but the airway answer is not always the most correct answer, right? It has to be the correct content. And one more piece for you NCLEX takers, NCLEX is testing what you should do as an RN. It's not testing what other people should be doing. It's testing what you should be doing in this situation. So keep that in mind when you're answering questions like, hey, is there an intervention here that I should do? For example, in management of care, a lot of times there's something you could do to get better assessment information. So then you call the healthcare provider and you have good information to give them. So always keep that in mind. It's testing what you should do. Does that mean it's never right to call the provider? Absolutely not. It is right in the right context, but always scan those answer choices and see, should I check or assess something before I call the healthcare provider? Would that not put the patient in more danger if I do it that way? But if there's something that you can check that will provide information to the healthcare provider to make a better, safer decision, you should do it because the NCLEX exam is focusing on what you should do. So you got strategy number 1. It is be particular. You want to make sure that you know that there's going to be often more than one right answer. The particulars are the context of the question, and no one answer is right on all situations. Well, there's another country heard from. So let's practice together. That's what we're going to do. All right. Thank you, Harley. So let's take a look at this question. I want you to think about the particulars. I'm going to go take care of that little problem while you're looking at this and see if you can pick out what are the particulars of this sentence. Let's see how you did. Did you get the 56-year-old? Remember, that's an age. Let's see if you got female. That's gender. Oh, we got information about their thing. They did not take their insulin this morning. And look, they're telling us, they said they have fever and nausea and tightness in their chest for the past 4 to 5 hours. Okay, that's a lot of particulars. Now, sometimes you'll see like, oh, it feels like overwhelming. Just tell yourself, no, I'm not going to be overwhelmed on this. I'm going to break it down like I know that I should. Because here's the deal. If you teach your brain to respond in stressful situations the same way every time, you're going to be much more successful. That's why we run Code Blues the way we do. There's an algorithm and we know how to follow through that. So we know that we do the best thing for the patient in a really stressful situation. You teaching your brain, even if you have ADHD, I have ADHD. So I know that sometimes that's hard to have that structure, but I promise you, if you keep practicing using these strategies, you're going to teach your brain so that when you do sit down to take a test, you're like, okay, we've done this before. I've done enough practice questions and I've thought through them. I know that I can be successful in this. So let's take a look as we keep walking through, but I want you to keep in mind that, oh, there's our things again. I'm sorry that popped up again, but I want you to keep in mind it's how you attack that question. Now, thank you to Monica and Margot. I think I caught out of the corner of my eye. You've got the link in there for people. So it's in the chat. So we're going to go on to strategy number 2. Now, strategy number 2 is to use your own words. First one, who can tell me what the first strategy was? Can you write it in the chat? What was the first strategy? Be particular. You got it. Okay, and you know how to do that. You're looking for particular about the patient, particular about the setting. Now, in strategy number 2 is to put the question into your own words. So see what we have up there on the screen. What's particular about that patient? I wrote it in a little box for you so you can see it. So how would you put this question into your own words? So go ahead and take a second and try and put this in your own words. You don't have to write it in the chat for me, but you do need to try and put it in your own words because I'll tell you why this matters. So let me pause for just a second and let you put it in your own words. And then I'll come back and tell you the educational psychology, the brain science behind why this will help you raise your scores. Okay. I gave you a little bit of chance to do that. That is something you need to work on. Another thing you can change on your test taking strategies, this will help you slow down with a purpose. Now, you may feel like, oh my gosh, I'll never get through these questions. No, you just need to keep practicing and trying it. But taking this information that you've identified as key factors and putting it into your own words is the mental gymnastics that your brain needs to do to make sure you are clearly focused. You want to be able to see right away what is important about this question so you increase your odds of getting it right. See, one of those particulars can change completely what is the most correct answer, and that's how you get tripped up. So you do it this way, you won't get caught with that. Now, I want to talk to you about how to dissect a question. Just really break it down like you are a cardiothoracic surgeon, right? Want you to be able to do that. So let's take a look. Again, it's all about the stem. Now, remember, the stem of a question are the words before the answer choices. That's just the name we give it, STEM, which is why you have it on the screen. So remember, you don't want any of these when you're dealing with the STEM, right? No ants, nothing like that. You're going to tell yourself, this is just a puzzle I can solve. You're going to put the pieces together and come up with the best answer. Another advice I give students is, man, you got to Elsa that. You remember that from Frozen? Elsa that means let it go. You do one question at a time. You do your best on that question. You follow your systems, your particular. You make sure you do step 1. You put the question into your own words, and then you just keep moving through the system. Now, these are 4 key things you want to watch for in the STEM. And Monica, who is our representative at Sigma today, is going to make sure that you get both a recording of this and you get these slides as a handout. So you're in good hands. You're going to get this information. So you can just hang out and listen with us. But these are the things you're looking for, these 4 important things in the STEM, right? Particulars. We already talked about the patient and setting. Think about the diagnosis or procedure. Already talked about that one. It's the worst case scenario and why you're looking for the worst case scenario. Let's say you have somebody who's going for a heart cath. What's the worst case scenario for them? Well, people sometimes say they could die. Well, right. Dead is not the outcome we're looking for. Never. But how would they get to dead or to harm? What are the things because of this procedure that they could end up being harmed? Well, in something like a heart cath, they're putting that big thing right in a big vessel. It could be either they bleed out or they have a clot that impairs perfusion to the rest of the leg. So they're going to see that, do you recognize for this procedure what risk the patient is at? That's what I mean when I say worst case scenario. And I'll show you how to take notes on that. But that is you're preparing for the NCLEX. If you want to know if you're ready, you need to be thinking about diagnosis or procedures and see if you are aware of what are the worst case scenarios just before dead that you should be on the lookout for. Now, you think about assessment numbers. Anytime you see a number in the stem of a question, you ask yourself, is that high, low, or normal? And what does that mean? So the good news, since 2023, you've had lab values that'll be right there in the question. Now that's pretty cool because, you before that, students had to try and memorize all these lab values and it just took up wasted brain space because anybody who practices knows we get the normal values right on the lab report. So that was just silly. I'm glad we changed that. But what you do need to know is, hey, what does a high creatinine mean? What does a low creatinine mean? What does a normal creatinine mean? Now, we do have a whole series on CBC and all that kind of stuff, and I'll break all that down for you if you're interested in looking at that. But you do need to know for this assessment information, is that high, low, or normal, and what does that mean? It could also be something even like a respiratory rate or a blood pressure. Just keep those all in mind. And look at that fourth option. Any assessment data, no matter what it is, you need to decide if it's normal or abnormal. Okay, well, you might be looking at this slide and thinking, okay, what does this have to do with me? No, this slide is really gold for you. If you're struggling with really understanding what's in the STEM, know that these are 4 examples where they could really be setting you up to not pick the correct answer. So you have to be careful that you've looked for any particulars in the context, in the patient, in the setting. You have to look for anything about the diagnosis or procedure and be on the lookout for any danger signs of that. You need to not ignore any assessment. If it's a number, is it high, low, or normal? And what does that mean? And assessment data, is it normal or abnormal? Now, this is going to feel like, what in the world? This can take forever. It will initially slow you down, but the more you practice, the better you're going to get at it, and the less you're going to make mistakes, which means your scores are going to be higher. So I would recommend you start practicing with some questions today and think about these things. Particulars for the context. Do I recognize what's challenging with that diagnosis or procedure? Do I know what to do with assessment numbers? And do I know what to do with this assessment data? Because I guarantee you, if you have a stem of a question and it said it has some abnormal assessment data, you need to do something. Because sometimes on the NCLEX, there's going to be an option for saying just document something or not do anything. Sometimes that is the correct answer, but if there is abnormal assessment, odds are that you need to do something. You need to do an intervention. So keep that in mind. If there's abnormal assessment, they're probably looking for you to do something. There is no one absolute correct or incorrect answer on NCLEX, but that's kind of a guideline to help you with the context. Okay, so these 4 are really important. If you start today trying to answer some questions and thinking through that stuff, I promise you it's going to change you. So let's try practicing together. That's what we want to do with you. So work through this question on your own and think about some of the things that we've done. Now, you've seen this question before. I want you to try it now with the things that we've talked about and you're learning about today. So be particular, think about diagnosis, worst case scenario, look for assessment information. I'm going to give you about 60 seconds to do this again on your own. Read through this question again. Okay, now as my camera's coming back on, here's what I want you to think about. Did you want to change your answer at all using those skills? Might be yes, might be no. But let me know in the chat. Did you change your answer at all? Don't have to tell me what you changed it to, but let me know yes or no. Did you end up changing your answer? Sweet. I'm going to celebrate the yeses and the nos. That's great because that just tells me you're thinking about your thinking. That's called, you want the big word? Metacognition. But by you thinking about your thinking, that's how you get better and that's how you get stronger on the NCLEX. And that's what we want to teach you to do. So I'm still not giving you the answer. We'll come back to it. But I want you to think about what do you do when there's more than one right answer, which is the struggle in nursing school, right? And the struggle is real. So let's take a look at this question. You've already read it. You've already looked at the particulars, right? We know they have Addison's disease and they've had it for 10 years. chronic condition. We know our context of our setting is a medical surgical unit. So they're in the hospital. They've been admitted for a reason. And when you're admitted to the hospital, it's stressful, right? So what symptoms might the nurse expect for this client when experiencing extreme stress? So this is somebody who has Addison's disease. I have to think about worst case scenario for that. I know they've had it a long time. I'm in the hospital. And what might I expect? So what would I expect for someone with Addison's disease a long time who's under stress and in the hospital? So we got the particulars. We know the worst case scenario for this diagnosis or procedure. Well, it's Addison's disease. And I bet you guys already remember with Addison's disease, can you tell me which organ it is that's not functioning? Can anybody remember? For Addison's disease, which organ is involved? Look at you guys, right? Kind of a trick question. It's the gland, right? It's the adrenal gland. Fantastic. Okay, so what would I expect to see in somebody whose adrenal gland is not functioning and now is undergoing stress? That's the worst case scenario for this, because Addison's disease, the worst case scenario is an Addisonian crisis. So let's take a look at this. If you're going to take notes and you'll be working on things like this, I want you to think about making a chart. Now, this is the way my brain works. You can interpret it however you want. But if you want to know if you're ready to take a question on Addison's disease, you put in the first column, Addison's disease. In the next column, you put the worst case scenario. The third column, how would I recognize it? Fourth column, what would I do? Now, let me tell you the secret. This is how we write test questions, right? If we're testing if you're safe, we're going to test, do you recognize what's the biggest risks of Addison's disease or an Addison's crisis? How do you recognize the symptoms without the patient saying, I am having a crisis? And then what would you do about it is the intervention. So we use this information to write test questions. If you study in that way, you've unlocked the secret. That's all you have to do. As you're preparing for NCLEX, you should have a notebook that when you're taking practice questions, that you have something like this just super quick. For a diagnosis that comes up, write out this chart, spend some time thinking through what these things are, what the worst case scenario is, how you'd recognize it, what you would do. And it'll take you time the first time you do it, but then you're going to go back and review that notebook. I think if you're taking the NCLEX, you can start a notebook today. If you're in nursing school and you're not taking it for a couple of years, this will help you in any of your pathophysiology, med surg, critical care courses. This will genuinely help you with that. So if you start doing this, right, you start using these 4 columns and you're writing that out, then on a regular basis, every day, you just spend about 15 minutes reviewing a part of your notebook. You do that every day over a period of time, you're going to have so much more confidence in your knowledge because you know the secret. You know, it's keep the patient safe. You know that you should know these 4 things about any disease, any procedure. You're also going to need to know similar things about drugs. Now, if you're really worried about drugs, I told you we've got that webinar that's in the repository for Sigma. It's an NCLEX review for pharm. If you want a little more detail on that, it's also available in our product. But this is key. If you guys would start doing this, it will help you deal with that worry and fear. Because when you start telling yourself, like, there's so much knowledge, there's no way I'm ever going to know it. You're right. You're not going to know it. And you can't go back and read your med surg textbook, right? You may not have read it the first time because it was so dense. But this is going to be the key to identifying what things do you need to know more about and how can you keep them in your notebook. Now, also, I'm going to tell you that a lot of the med surg stuff, if you like this teaching style, I've done a lot of videos, like hundreds of videos on these topics that you can also watch those. So there's your adrenal gland. You see it right there. We got a problem going on. You're going to figure out worst case scenario. And I'm going to show you that you have it right there where you can see these 4 columns, kind of what you'd put together. So the diagnosis is Addison's disease. We know the worst thing is an Addisonian crisis, which means they don't have enough of the adrenal hormones, which we got them all listed there for you because our goal is not to teach endocrine today. Now, how would you recognize it? Might be something like a vital sign change. So what would you do? Well, these are super important. Right? We're going to have them rest because they can't respond to stress. We're going to have to replace the steroids, and we're going to have to also replace fluid. Now, again, we don't have time to go into detail of the endocrine stuff, and we do that in some of our other videos, but I want you to think through What's the first thing you should do? What's the most important thing you should do? Might be a different answer. So which one should you, what's the most important thing that you're going to have to do for this patient to be okay out of those three? What do you think? Is it rest, replace, or is it rest, steroids, or fluids? Go ahead and be brave and tell me in the chat if you think so. Okay, now do you see how we've all picked different answers? Now, my wording was, what's the most important? Now, part of this, what we got going, and indulge me for a minute as we talk about the endocrine stuff. Okay, cortisol, that's how we deal with stress and inflammation. Aldosterone, as my students always hear me say it. The job of aldosterone is to tell my kidneys to reabsorb sodium, right? And wherever sodium goes, water follows. Okay, so if I am in a crisis, I don't have enough aldosterone that's going to stimulate my kidneys to reabsorb sodium and water. So I'm going to pee out everything I have. And that's why somebody in Addisonian crisis is like a dried up potato bud. They've peed out all their fluid, which is why we need to replace their fluid. But you can replace their fluid over and over and over again. But until they get that aldosterone, they're not going to be able to hang on to it. It's just like pouring water into a leaky bucket. So now if I ask you that question, what's the most important thing that we do for this patient? What is it? What do you think? There you go. And do you understand the rationale? And see, because you think like, yes, we do need to replace fluid. Yes, they do need to rest. Yes, we do need to give them steroids. But which one is most important? Steroids. Now, you only get that in a test question because in real life, what would we do? We do both and we do them simultaneously. Nurses are like octopi arms, right? We're going to do everything at the same time. But in questions, they want you to know. So you are correct. The most important thing, if that was the wording of the question, is to replace the steroids. And then we'll be able to have a fighting chance. So we talked about this. We talked about the diagnosis procedure. We looked at, we don't really have any assessment numbers there, right? That doesn't help us. So you see that changes to none. We're still in that same question. Do we have any assessment data? Okay, again, they got us none and none. This will happen to you. Not all questions will have all assessment numbers or assessment data. That's okay. This type of question is trying to see, do you know what to expect and what to be on the lookout for? Which, if you had like someone you really cared about in the hospital, that's what you want a nurse to do, right? You want them to be aware what risks are particular for your patient or your loved one and make sure they keep an eye out for it and they know what to do if it happens. So it's not unusual that this doesn't have assessment numbers or data, but many questions will. You put this question into your own words and you've already done that. Once you've done this work, you are good to go. So we had these four options, right? Now you see down in the corner, I've got that little like how I want you to consider taking notes. You do it however you want. Because nobody else needs anyone telling them what to do, right? That gets a little old. But look at each one of these answer choices. Now, when you're at this point in the question, you've done your work in the STEM. You've put it into your own words. You know the particulars. You've done worst case scenario, what you look for, what you would do. You've put it in your own words. Now we look at the answer choices. Here's the hardest thing. You're going to have to eliminate answers and say why. Okay. And this is the part we all avoid. It's like, well, I don't know. And this is uncomfortable. I just want it to go away. No, 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 no. That's what you're going to have to do. So you think about which one will be eliminate. Well, so asking me what symptoms I'd expect in someone in an Addisonian crisis who's experiencing stress. I would not expect an increased inflammatory response because they don't have the hormones for that. And they're definitely not going to have high blood glucose levels because, again, they don't have the hormones for that. So that's out. So I eliminated it and I said, why? Now, the next one, you're going to keep working your way through the question. So if you pick number one, that's why it isn't right. You just want to keep telling yourself, why is that not the most correct answer? Now, number two is out because we know the patient doesn't have what hormone? Which one did we talk about? What's the hormone? What's the hormone that this person doesn't have that would cause them to have low blood pressure? And you get extra points if you said aldosterone, right? So, someone also got epinephrine. Oh, good points. Look at Jennifer. We could be friends. Okay, so you caught on number two. Hey, they don't have epinephrine either. Excellent. You got that even deeper. So since they don't have either, they're not going to have increased blood pressure. They're going to have decreased blood pressure. That's why we get rid of number two. Now, if you look at number four, low blood pressure, low blood glucose level, we got to look at what's going on there. You want to work your way through why is it not extreme fatigue and increased blood glucose level? Well, we know they'd be tired because they don't have any epinephrine. But would they have increased blood glucose level? No, they would not because they don't have all those hormones. And so that's why number four is the most correct answer. Low blood pressure and low blood glucose level is a sign and symptom of an Addisonian crisis because they don't have those hormones to stimulate. Yeah, excellent, Angela. You're putting that together. So now what I want you to see is, can you see how taking notes in this way about a diagnosis or procedure, how you can use that to sort through all these? Because sometimes when you see a question like this, like high this, low that, low this, high that, your brain can get really confused and you tell yourself, that's a feeling. Here's how I can refocus my brain. Here's what I know. I'm thinking through this. And what I would recommend is that you think through worst case scenario before you ever look at the answer choices. And I know you're going to be like, that's crazy. I'm not doing it. I get it. But if you would even like put your hand over the screen, once you look at those answer choices and you're not clearly focused, they can talk you into anything. And you guys know who I'm talking to, you answer changers, right? I am an answer changer. So don't look at the answer choices, be rock solid on what that question is asking you. Make sure you've used the worst case scenario, then look at the answer choices, eliminate the answers as you go through it and say why. Now, when you get down to that, say, does this make sense? And sometimes you might be like, listen, I have no idea what this answer choice is. You just do your best and say, I am not surprised that this happened on the NCLEX. They told me to expect. I get a question, I don't recognize the diagnosis, or I don't recognize the med, or I don't know what the correct best answer is. Then that's what you do. Say, this is one question on a whole test. I'm going to do my best, follow my strategies, and I'm going to ELSA that. Let it go, because no good will come from me worrying about getting the wrong answer and getting stuck on all that. That's where you get really messed up. So we saw what the correct answer is. You got it. What I'd like to know is in the chat, how many people changed their answer? We know how many people changed their answer. Did anyone change their answer to the correct answer? So write the word correct if you change from the wrong answer to the correct answer in the chat. Look at you. Nice. Excellent. So what you can say is it works, right? It works if you're prepared and you think through it. Again, don't try and cram all this more content information in your brain. Only selectively put content information in your brain and put it in there in this manner. What I'm saying, put it in there, is use those 4 columns, put it in your notebook, and you'll consistently review that. Now, you want to know the magic question that you'd ask yourself every time when you're reviewing your notebook? Why would a nurse need to know this? How would a nurse use this to keep a patient safe? Why does a nurse need to know that someone with Addison's disease has an Addisonian crisis? How could they use it to keep a patient safe? Well, you'd recognize the symptoms of an Addisonian crisis and you would intervene, right? You would recognize that a patient under stress who has Addison's disease is at risk for a crisis, because that's the application. Remember how you felt when you first took the test, the first nursing school test? You were overwhelmed because nobody had taught you how to think that way yet. All of your other classes were like, memorize this fact, spit it out on a test, and you're going to do fine. Nursing is an applied science, right? So you have to take the information, process it, chew it up, and know what's the most important thing to do, because people's lives are in our hands. That's why you have to think differently on an exam, right? Okay, so you're doing really good. I'm so excited that some of you changed your answer to correct. Remember, it's always about the why. Why am I getting rid of that? What are we doing? Because you want to eliminate answers and say why. You don't want to just gravitate to the most correct answer or what you think is right, because usually what a lot of times happens is people think through the question, they're really stressed, and they don't know what to do, and they start, blah, blah, blah. No, stop. You're better than that. You're going to say, I'm going to think through this systematically. I may or may not know this, but I'm going to do my very best with the knowledge that I do have. I'm always going to say why when I eliminate an answer choice, and I'm not going back unless the one I pick makes absolutely no sense. Once I eliminate an answer, I eliminate an answer. Now, you get a write-on wipe-off board at the NCLEX, so you can do this. You can use this strategy. I'd recommend when I would do the 4-day NCLEX reviews, I would always bring paper for the students, let them write down 1, 2, 3, 4, and make sure you cross through those and say why. Teach your brain to do that. In fact, if you're studying and taking practice questions, please don't do it when you're like laying down or you're in bed or you're distracted. Try and set up the environment in a quiet environment, which means you can't have an angry miniature schnauzer in your environment. You want to set up a quiet environment. You want to be looking at a computer screen. You want to be using a mouse, whatever. It's going to be the similar environment to your testing environment. And just use a piece of paper, 1, 2, 3, 4, eliminate those answers and say why. And the more you do this, you're going to gain such valid confidence in your skills to answer questions. Can be fantastic. Because remember, on the NCLEX, it's not like nursing school exams, where nursing school exams, they take the number you got right, divided by the number that you got wrong, and that's your grade. On the NCLEX, you start at this baseline, right? You start kind of right like here. If you get the question wrong, you get an easier question and an easier question and an easier question. If you get it right, you go above it, above it, above it. So if you're answering hard enough questions, man, you can get 50% and still pass the exam as long as those questions are at an appropriate level of difficulty. Now, can you figure this out on the exam? No, you cannot. Because I know some of you are going to be like, if you knew a question rock solid, you're going to start to question yourself and say like, well, if I knew it, that can't be. That can't be. That question was too easy. I got that answer. None of that stuff is appropriate to be in your mind. That's another automatic negative thought. I promise you, you just have to take each question individually, do your best. What happens if you get the same content in 2 questions in a row? Does that mean you got it wrong? No. I promise again, content is not what decides the next question you'll have. Level of difficulty. So it might randomly be the same content, but that doesn't mean you got it right or wrong. That just means you got another question. And sometimes you will not be able to tell if the question is harder or easier, right? So don't talk yourself into, oh, that question was easier. No, maybe you were just more familiar with that content and it was actually a more difficult question, right? And even if it was easier, should that change your behavior? No, you got to stick with your plan. There used to be a person here in Oklahoma that when people would check in for the NCLEX, they give them advice, really bad advice. And I was like, no, that person has never taken the NCLEX. They've not studied the NCLEX. Don't change your test taking strategy the day you take the exam. You stick with what you know. And the more you guys practice this stuff, the better it's going to be for you because you don't want to gravitate to the wrong answer. Okay, so we're coming back up to our coupon here. It's here again. I would welcome taking any questions that you have. I really mean it with the NCLEX course. If you like the strategies that you've put here, these are different than the ones that are in other NCLEX review courses. I don't believe in giving students hundreds and hundreds and hundreds of questions to answer, and that's going to be the answer. I don't believe that. I believe it's how you break down the question when you take it, keeping up with your notebook. It is definitely the quality of your study, not the quantity of your numbers. In fact, I just taught a faculty webinar. Not a webinar, I was in person for 3 hours with these poor faculty. And I asked them how many of them were requiring their students to do thousands of questions. And many hands went up. And I'm like, I'm going to tell all of you, I think that's wrong. And let me explain to you why. Because you guys click angry. When you have to answer questions, you're like, I want my life back. And just mad, right? It's no quality. But if you would answer questions and try this strategy, do the things I'm asking you to do. Look at the context, look for assessment, look for numbers, look for those 4 key things that you eliminate, not gravitate, that any new thing you learn in the rationales when you're reviewing the question, if you'll write that in your notebook, just as a fun fact, you don't have to go back and try and cram a lot of knowledge into your brain. You have to learn to take the test differently. And I can say with my whole heart, this works. And if you want more of this, This is all included in our monthly subscription where you can get the whole course that I guarantee you in my 20 years of experience, you can take this course and be ready for the NCLEX exam. And I would love to celebrate with you when you pass the NCLEX exam. So check it out, see what you think. You've got the QR code up there. And Monica, we are right at our time. Is there anything else you would like to bring up with the students before we let them go back to nursing school?
I'm so sorry. Did not realize I was muted. My bad. I just want to say thank you so much to our presenter for all of this great information. Sigma is extremely grateful that you took the time to share with this audience and look forward to hearing more from you in the future. We hope you've enjoyed this webinar. As was stated before, within a few business days, we will have the this presentation and a downloadable option for these for like the PowerPoint and the like available on the Sigma repository. You will receive an email once it is available. All right, and that was it. So I hope everybody has a great day. And
Hey, thank you. Oh, sorry, Monica. I'm just saying thank you
yeah,
for all your kind words and the statements. We really want it to be practical. I have a short attention span, so I want it to be super helpful for you guys. Yeah, and I hope you'll join us in our community. My privilege. Hang in there. No negative thoughts. Thanks, Monica.
thank you. Everybody have a great day.